Thank you very much for your kind introduction, and I'd like to give a big thank you to you and to Dr. Boussoy for your support for the platform and also for being here today. I know you have incredibly busy lives, and it's really great that you're here, so thank you very much. Can we please... I'd also like to thank Mr. Setchell, who has actually given a lot of my presentation already. And that makes life much easier because we are running behind time. I have a system to stop people running behind time. There are 11 speakers, that's a football team. So the speakers in my session, when they get to 4 minutes to go, will be given a yellow card. When they get to 11 minutes, they will be given a red card, and I will blow my whistle. And so we will have no long presentations, please. I have to stick to that, so time me, and you can whistle at me if I go over 10 minutes, okay? That's important. So, what is the platform for better oral health? Who are we? Well, we are a collaboration between the Association for Dental Education in Europe, the Council of European Chief Dental Officers, and the European Association of Dental Public Health. And I'm delighted that the presidents of ADE, of CECDO, and actually EADPH, because I've actually become the president of EADPH, not the vice president, are here today. We are supported and work with two companies from the dental world, and that's GSK and Wrigley, and we have a very fruitful collaboration. And the secretariat is run here in Brussels by Hill and Knowlton Strategies, and as you've already found, they are incredibly efficient, and we're very grateful to them. So that's who we are, and what are our aims? Our aims are really quite straightforward. They're to promote oral health and the prevention of oral diseases as one of the fundamental actions for staying healthy. And of course, to reinforce Martin Setchell's words, very much to ensure that oral health is totally integrated into general health and that it is not separated. We have had this rather unfortunate situation and partly it's due to dentists and partly it's due to our other health partners, that we've tended to go off into a little, I think the Dutch would say lager, is that correct, lager? The Boer word where you put the wagons around and you have a defensive wall. German, okay, apologies. Apologies for that. And this is really no way to improve things in the future. We are aiming to address oral health inequalities and the major health challenges, particularly as far as children and adolescents are concerned, and of course the ageing population. And we've already heard very eloquently from Martin Setchell the difficulties with the elderly and populations with special needs in Europe. We're aiming to develop the knowledge base and strengthen the evidence base, and particularly to improve the quality of data that are reported. And I'll be saying more about that later, and indeed so will the speakers that follow me. I've already mentioned mainstreaming oral health across all European EU policies, and finally to provide sound advice and recommendations to European institutions for action with regard to oral health policy development. So, I will now come on to the report which we have produced, and this has been our first output together with this summit meeting. The full report is on the table there, and in your packs you will have an executive summary, a little smaller one, and it will be going on the platform's website, so you will be able to download copies from there as well. And a particular thanks to Dr. Reena Patel, who's sitting at the back. Reena, will you stand up, please? And Reena has done huge work in helping us put this together. So I'll now briefly go through some of the key points from there, and further other speakers will develop them in more detail. Now, it does focus on 12 EU countries, and they're not necessarily those with better available data. They are the 7 largest by population, and the 5 who are about to have or have recently had the presidency of the Union. So that's not quite correct there. It does look at prevalence and trends of oral disease. We try to make an economic assessment, and that's very difficult. Identify best practices and make key policy recommendations. These are the key findings simplified. Oral diseases are, of course, a major public health burden, as already been mentioned, and access to oral health services is a problem for many, particularly the lower socioeconomic group and many vulnerable people. And so the better get better and the worse get worse, and that is a problem across health. And I think we really mustn't forget that. There is a very significant economic impact, and it isn't just money, it's also quality of life. But we have made an estimate of the costs, and I'll be moving on to those in the future, and you'll find the amount is very surprising. And there is a lack of policy emphasis placed on oral diseases and prevention in particular, and this is partly responsible for the current situation, and in part that's due to the not very good epidemiology and economic data available. So that's really the big picture, the headlines. A little bit about each of these areas now, and first of all, the major public health burden. Now, I think these data have already been mentioned in the presentations before, so I'm not going to go over them again because you've already heard them and they are in the report there. But the Eurobarometer report suggested that only 41% of Europeans still have all their natural teeth. I didn't believe that when I first heard it, but then I thought if you're including 32 teeth, including third molars, I can then believe it. But it does seem a very high figure, a low figure. So, economic impact. This has been a difficult one to assess. It's a challenge to estimate expenditure in the provision of oral health care services, and particularly in the private sector, because the patient is paying the dentist straight from the pocket. If you have the government involved, subsidising treatment, or if you have an insurance company, you can have a much more accurate estimate of what's going on. Nevertheless, each of the countries in the Union has made an estimate here and provided it for us, and we believe that in the current year, 79 billion euros are spent on oral health care. And if you assume that there'll be 2% inflation, then that will be 93 billion by 2020. Oral health care is provided by a workforce of over 1 million, and so it's a major player. And if in fact we were quoted as a company on the European bourse, I understand we'd be in the top 50. So it's big business. But are we getting value for our money? Well, I'm not so sure about that, because I think that if we were doing some prevention, we would be able to be very much more efficient. So we have to understand the problems. There is a lack of emphasis placed on prevention, and you've already heard about that. And again, we come back to this lack of data to be able to see exactly where the problems are there, and I will pick that up. But what we can ascertain, we believe that the current trends are that periodontal health, this is gum health, is not improving, and oral cancer, certainly there are reasonable data to show that the situation is getting worse there. Oral cancer really is the major killer in the mouth. Generally, the other dental diseases don't result in death directly, but oral cancer does. There is this increase in health inequalities, and as the financial situation worsens, I'm sure that the group of humanity, who I rather cruelly describe as the great unbrushed, are going to be even more unbrushed, because, frankly, buying toothpaste and brushes is not a priority if you are short of money to buy food and very basic things. So I think we'd all have a worry that that could increase in the future. There is this lack of integration of oral health into national and community health programs. That's already been spoken about. Lack of research in oral health promotion, and the other points which you can see there on the slide, looking at the clock. So, in the report, you'll find that there are 5 policy recommendations, and the first is to develop a coherent European strategy to improve oral health and have quantifiable targets. This is in line with WHO policy, and Paul Eric will be talking about that in a few minutes. To improve the data and the knowledge base by developing common methodologies and bridging the research gap in oral health promotion. Third recommendation is to support the development of cross-sectional approaches with health and social care professions working together, and also supporting the development of the dental workforce so that the dental workforce is more appropriate to the disease patterns which we will be seeing in the forthcoming years. And they're not going to be the same as they have been in the past, and that's quite clear, I think. Addressing the increase in oral health inequalities and lack of knowledge of prevention and oral health practices by a lot of the public, and guaranteeing availability and access to high quality and affordable oral health care. That is a very difficult one, and I really don't think we can underestimate that, but we must have it as a goal though, nevertheless. And encourage the sharing of best practice across countries, letting everybody know what the successes were and what the failures were, so we can benefit from other people's experience. So, there are some very good examples of good practice, and they are all described in the report, and I'm not going to go into any of these one by one, because as you can see there are a lot there, but I encourage you to look at the report and to see those in detail.